The death of actor Chadwick Boseman has brought the threat of colorectal cancer into the spotlight. Dr. Dattani with St. Alphonsus shares the urgency of the need to be aware of your colon health. Dr. Dattani, let's talk about colorectal cancer. What are the symptoms?
Thank you for having me here today. The most common symptom of colorectal cancer is actually no symptoms at all, although some patients may develop change in bowel habits, bleeding per rectum, abdominal pain, or anemia.
Okay, and who's most likely to develop colorectal cancer?
So everyone's actually at risk. Colon and rectal cancer is actually the fourth most commonly diagnosed cancer in the United States. Those that are at increased risk are those with a positive family history of colorectal cancer, personal history of colonic polyps, certain genetic syndromes, also inflammatory bowel disease. We know that African Americans are also at increased risk for colon and rectal cancer.
Is this something that can be prevented?
This is certainly something that can be prevented. We recommend patients to talk to their primary care provider about going for their screening colonoscopies. There are also stool-based tests that can detect polyps as well. Colonoscopy does, however, remain the gold standard for screening.
Okay, and when it comes to screening, I understand too that some of the guidances have changed. So tell us about that.
So screening guidelines have actually changed if you go back to 2018, and there has been new evidence to show that screening should be changed to age 45. We are finding an increased incidence of colon and rectal cancer in younger patients, and the unsettling information on that is that we don't really know why.
Yeah, that is unsettling. In that regard, how is colorectal cancer treated?
So colon and rectal cancer is treated based on stage and location of the tumor. Sometimes I'm involved with a medical or radiation oncologist, and those tumors are treated with chemotherapy or radiation first. A lot of times, if colon or rectal cancer is found early, it's treated with surgery alone, and sometimes surgery is curative.
And Dr. Dattani, I understand that you have a specific approach to treating colorectal cancer, so tell us about that.
So I'm a minimally invasive, robotically trained colon and rectal surgeon. Using the Da Vinci robot, I'm able to remove the tumor. There are many advantages to using the robot. It gives me 2 additional arms. It gives me more precise vision. I have 3D vision. I'm able to do the surgery through very small incisions, and patients are able to make a fast recovery. A lot of times they're up and walking the day of surgery, and they're already eating the first day of surgery.
Wow. Okay, so a much quicker turnaround when it comes to the treatment and the healing itself, which is fantastic. Doctor, where can people go to learn more?
StAlphonsus.org.